Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. The year 2020 was really focused on COVID-19, and the pharmacist's role really focused in on treating patients infected with the virus. And if you look at articles that were published during the year, you'll see that, of course, there were a lot of articles written that were pertaining to this topic of treating patients with COVID-19 infections. So today I want to talk about one article in particular, and it really dealt with disaster planning and the role of the pharmacist in disaster situations such as a pandemic that we saw with COVID-19. And within this article, there's a specific mention of the pharmacy informaticists and their specific role. So this was a great article for me to see and very interesting, and I hope you find it interesting too. So let's bring up the presentation and we'll talk about this article. And this is on COVID-19 disaster management. If you go to the AJHP website, the American Journal of Hospital System, Health System Pharmacy, you'll see that every year they publish the top 25 articles that were downloaded from their site. And you see they have a list of articles going back to 2017. So this is a list for 2020 that I was looking through. And I found this one article on maintaining comprehensive pharmacy services during a pandemic. And they gave recommendations from this one facility that treated a number of patients. And here within the article, they talk specifically about pharmacist's role and the pharmacy informatics and data management role. So the pharmacists with expertise in clinical informatics can play a substantial role in emergency preparedness by applying their knowledge of these four areas. So as a pharmacy informaticist, remember, you have some unique knowledge and skills that other pharmacists and other healthcare professionals do not have. Number one, you know pharmacy practice. Number two, you are very well versed in medication safety. As we've discussed in many episodes on this channel, med safety goes hand in hand with pharmacy informatics. And then you know about health information technology. You know about all of our IT components of pharmacy practice and automation. So all of the apps out there, all of the robots and machines that we use within pharmacy practice. And then you have a good idea and know much about the structure and operations and maintenance of clinical information systems. So mainly talking about the electronic health records. So with that knowledge of pharmacy practice, med safety, health IT, and then clinical information systems, you're in a perfect position to help in these disaster situations. And so what are the types of things that we would be involved with as pharmacy informaticists with disasters such as the pandemic? Well, number one, we want to customize the maintenance of the EMR. And so I think that in this case, we want to make sure that we are providing the latest therapies, that we're able to document the administration of those medications and make sure that we have the right CDS rules that we're building into the system to make sure that we can help the clinician kind of guide them with clinical decision support. And then we have passive CDS. Remember, we've talked about order sets. So we can have evidence-based, based on the science, based on whatever has been published so far, what the best therapies are for the situation, and create custom ordering templates for individual drugs, and then create order sets that can help kind of passively guide the clinician to prescribing the optimal therapy for our patients. And then computerized prescriber order entry, so CPOE, and CDS we've talked about, and you have a direct input on that. You're probably the person in charge when it comes to medications of deciding on or leading the efforts into CDS, and in the case where it's new therapies, writing custom rules to help the clinician with prescribing. And then also we have other situations that come up, such as drug shortages and restrictions and alternative medications that might be used. So it's good for the pharmacist informaticist to be directly involved with looking at the data, seeing what's going on with prescribing, and taking care of those systems. When it comes to data analysis, so we have things called dashboards, just like on the dashboard of your car. When you're driving, you want to see gauges that show how fast you're going, and maybe the tachometer to show how fast your engine is turning, and then other indicators of how much fuel you have left and the range that you have for driving and things like that. Well, in health informatics and pharmacy informatics, we also want dashboards. We want scorecards that show us how we're doing with our prescribing, with our inventories, number of patients that might be infected with the virus, and what we're using to treat them. Just little gauges and visual effects that show us how we're doing with COVID-19 pandemic management, disaster management. And then we can also look at indicators that might tell us how acute our patients are and what's going on out there. So if we have a lot of code blues, we have a lot of card exchanges, we're using certain medications to a very high degree and need to make extra efforts to keep those drugs in stock, and have statistics on order verification, our order volume, and what kind of medications are coming through our CPOE system, what we're compounding, what we can buy, and what we have to make because it's not available, especially with new therapies that we might see with treating the virus. And then just looking in general about the complexity of our patients, how many are on a respirator, and how many respirators we have available, how many beds we have available for treating these patients, maybe in isolation. All of that can be analyzed and help us making decisions about how best to treat our patients, how to manage our patients in these situations where we have a flood of very sick people that are infected with the virus that we're trying to treat. That's a new virus, and we're trying to learn as we go. So real-time analysis of our situation is extremely important. And as a pharmacy informaticist, you can really set these things up and interpret the data so that it really helps our department and our clinical partners in doing our work and taking care of our patients. And then just from an administrative business view, it's good to do analytics on the types of interventions that we're doing and how we're managing our inventory, and really looking at costs, because of course when you're a disaster situation, you're treating kind of a novel virus, something new. New medications are coming out. You have medications that maybe we don't want to use, like hydroxychloroquine. You have other things like remdesivir that are new, very expensive, that you do want to use, but you want to use judiciously. So, you really want to keep track of your usage of these items, discourage the use of some and encourage the use of others, and in all cases, kind to look after how they're being used, if they're being used appropriately for the right patients, so that we have enough drugs for the situations where they're needed the most. So hopefully this was an interesting discussion for you on the pharmacy informaticist role in disaster management, and specifically talking about what we've seen in the last year or so with the COVID-19 pandemic. But of course, going forward, we don't know what the future holds, and there might be some new challenges out there. So you're in a unique spot as a pharmacy informaticist to really help optimize the drug therapy of our patients, really help our administrators and our colleagues in managing the situation and treating our patients in the best way. So if this was helpful for you, please like the video and subscribe to my channel, and I will thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others, and I will continue on working on more episodes, and I hope to see you next time. Take care.